Hi PSWs, this is Steph. Today I'll be demonstrating foot care as I prep the client for the foot care nurse, Karen Meekus. Today I'm going to demonstrate how to do foot care. I'm going to pretend you're knocking on the door and coming to see your client. Hello, Mr. Door. I'm here to do your foot care. My name's Stephanie. I'm your personal support worker for the day. Is it okay if I do your feet today? Okay. So you want to make sure you wash your hands or sanitize. Put on your gloves and have everything nearby. Okay, so I'm going to examine his feet first, looking for redness or any blisters. So it looks pretty good. Did you want to take a look at your feet?
Sure.
Look at this one. Looks pretty good. So I'm going to get you to soak your feet one at a time. So you'll probably do it about 5 to 10 minutes, but we're just demonstrating, so I'm going to get a washcloth here, put a little soap on it. Okay, I'm going to take one foot out, and you're just going to wash all the way around the heels and in between the toes. I'm going to get you to put your foot back in, just to wash off the soap. Okay, now we're going to take it out and dry it off. And you want to make sure you dry in between the toes, so there's no fungal infections or moisture. You're going to use a corner of your cloth here. Alrighty. Do this one. That tickle?
A little bit.
Okay, so that one. So you want to make sure you have like 2 to 3 cloths. Dry this one off. Okay, so this is when the nurse comes in to do the rest of his foot care, and then after we'll put on some socks and get him all set.
Hi, Mr. Dar. I'm
Hello.
Karen, and I'm here to do some foot care for you.
Okay.
Is it okay if I go ahead and proceed?
Yes.
Okay. So, just like the PSW did, she'll wash your hands, she'll hand sanitize, and then glove up. So basically what I'm going to be doing is just showing you some utensils that I use, that I frequently use for advanced diabetic foot care. And so, again, we'll do another inspection of the foot. And I'll just take the mirror and just go underneath, check your heels, check your midfoot, check in between your toes, because I can see from the top, but I can't see from the bottom if there are any ulcers, calluses, corns, or wounds. So everything looks good. Now I'm just wondering if you could demonstrate the same thing. And looking at your own foot, look at your heel, look at your midfoot, and look at your toes. Spread them if you can a little bit, just to take a peek in between to see if there are any calluses, corns, or wounds. Okay, good. This is called a podiatry kit, and there's a couple tools in there that should only be used by specialized foot care nurses, okay, which I am. So I'm going to open this up. Let's say I have my gloved hands on, and this set will not be used. It's just for example. So because it's the way that it's wrapped up, it means it's sterile. There were no tears, there were no rips, there were no openings. So with my gloved hands, I'll pick up my kit, and what I have in my kit right here is a pair of nippers. It's a specialized nail clipper, as well as a metal file. You can put slightly middle. And then I have something called a curette, which helps me maybe lift the nail if I need to inspect an ingrown toenail. And I also have a handle for a scalpel. And this is for the specialized foot care nurse to take care of ingrown toenail and sometimes debridement. Debriding means to remove excess skin, excess fluff or whatever, as well as to cut some of the nail that would be growing into your toe. So I'm going to put that back because we won't be using that today. And some of the things that I do with the nippers is I just inspect like how the nail is growing, and I even like take the nippers and shorten it, and I use my curette to separate the skin from the nail, and then after that's done, I'll use the file. Sometimes I use a tool called a Dremel, and that's like a little tool that it basically it's like a little drill. Not a drill where it goes into the skin, but a drill where it would like take excess nail and just thin it a little bit. So I would just be going over the nail and thinning that nail and making it soft, making it so it has softer edges. So after that's all done, we'll inspect the foot. Usually foot care nurses provide any kind of dressings or any kind of wound care dressings, band-aids or special dressings if there is a callus or a wound or some kind of an ulcer. A lot of diabetics do not feel their sores that are on their feet. They don't feel the cracks in their heel at times, and sometimes they don't even feel when their ingrown toenail is making their toe bleed. So when a foot care nurse comes in, she'll have everything in her pack. She'll have wound care supplies as well as foot care supplies, and then all the extra. So what I do also is I moisturize after and provide you a pair of either diabetic socks or some nice soft lady socks, and I leave some things for you. So one of the things that I leave for you as my client or as my patient is I'll leave you this metal file. This metal file is for you to maybe soften the edges on your nails or even to soften the skin on your heel. Okay? It's kind of rough. Yeah. So you get to keep this. I'll give you another file. I'll even give you a nail clippers, which I won't be using. I'll give you a clippers, but I highly suggest you call your foot care nurse if you need to shorten your nails. If you are diabetic, then you are at risk for infection, especially if you were to cut your nail too short, which we don't want ever to happen, okay? So at my angle, when I'm sitting at your feet and taking care of your feet, I can see better. Sometimes I even use a headlamp just to have an extra light really close to your foot so I can see clearly. And some of the other things that I leave with you are some smaller sample moisturizer packages, as well as, a pair of socks. And that's it.
All right. Moisturizes feet. And if he has rough heels, we'd use the stem here. So you gotta make sure you don't put any in between the toes. And use a non-scented fragrance. And a good moisturizer, so like Lubriderm or Dermotherapy. How does that feel?
Okay.
Good little massage. Get the circulation going. So Mr. Dora picked out these really nice socks today. Mm-hmm. Keep his feet nice and toasty. There you go. I'll do the other foot. And there we go, and then you're gonna get rid of the water and the pad and wash your hands and take off your gloves. Have a good day, everyone. Bye.